We are joined by Dr. Michelle Bache, Vice President of Medical Affairs at Elkhart General Hospital today. Dr. Bache, so tell us about the current situation in Elkhart County with COVID and at Elkhart General Hospital.
Sure, thanks, Heidi. Hopefully everybody's aware by now that we are seeing a significant increase in our number of cases of COVID in the community. That's been going on basically since the beginning of September, where we saw a pretty dramatic increase in the number of positive cases that were coming back. So we've been trying to sound the alarm to the community because we were concerned that that was going to result in increased hospitalizations, increased demands for beds, and services that would be difficult to accommodate. So, we've seen that transpire. So we have seen our inpatient census really for the COVID-19 patients increase at a very rapid and concerning pace since the beginning of September. September 1st, for instance, we had 11 COVID patients in our hospital. On October 1st, we had 26. On November 1st, we had 61, and yesterday we had 89. So, that is just a rate of increase that is really been challenging. Today at the hospital, we have 103 patients in the hospital that are in isolation for either a confirmed COVID positive test or we're waiting on test results, but we have suspicion that they're positive. So, that's difficult to deal with just on an operational basis, trying to flex spaces, trying to find the staff to accommodate that demand, because we still also have other illnesses that we need to take care of in the community besides just COVID-19. So there are still people who have other very serious and important medical needs, and we need to make sure that we can continue to care for those. We are trying to balance that in looking at, for instance, our surgical cases, looking, really into the next week, and then on a day-by-day basis for what cases we can proceed with, which cases we can, accommodate. Some of them, we don't have a choice because they are, not things that could safely be postponed for, even a week. So we are having to continue to do some of those very important services, but other things that could be safely postponed, we are doing that and doing more of that more aggressively.
So Dr. Bache, obviously with this number of additional patients, what are we doing to accommodate them space-wise within the hospital?
So we are walking the hospital looking for any bed that we may have in the hospital that, we could put a patient in. The hospital is, we have an older hospital, and we have made some adjustments over the years that, some places in the hospital that we used to care for patients, for instance, maybe weren't currently being used. So we are rapidly expanding into all areas. So the first step is finding the space. The second step is finding the equipment that we need to take care of the patients as well. So looking for hospital beds, looking for bedside tables, looking for IV poles, IV pumps. We're renting those. We're trying to, get those from all other places, because it's just, every single little supply that you need to render patient care. We're stretched on that. And then the second piece is of course, the human resources, all of our staff. We're just really continuing to be very aggressive with our efforts to get traveler nurses, trying to get traveler respiratory therapy, trying to get traveler lab techs, anybody that we can get to fill those roles. So.
Tell us a little bit about these patients. Tell us, a lot of people out there are thinking that it's only seniors and younger people, really don't get COVID or don't get it bad. And what can you tell us about the patients that you're seeing, the wide range of them?
Yeah, so we are seeing an increase in the number of I'll say younger patients who are requiring hospitalization, and, by younger, I mean, 40s, 50s, things like that. It was early on, it was, more of an issue concentrated in the senior community, particularly nursing homes. That continues to be a big problem, but we are seeing, because of the degree of community spread, household spread, workplace spread, we are seeing patients in their 30s, 40s, 50s that are coming in and requiring hospitalization and care.
So what message do you have for the community at this time?
Yeah, we really need the community's help in this. And again, I just want everybody to know it's not just about COVID. It is about, the limited resource that we have in the healthcare system to provide all necessary care. And when you have a situation like this that just so rapidly and aggressively consumes your resources, it's going to affect everybody. So we need the community to take this seriously. We need the community to do their part to decrease community spread. We won't see a decrease in the hospitalizations until we see a decrease in the community cases. So that is the part that we need help with. So masking, social distancing. We would encourage employers of businesses and companies that have a workforce that can work from home, if that is an option, that they do that, and they have their people at home and not in a place where coronavirus can spread in a break room or in an office setting. And testing. If you have symptoms, please get tested by identifying the cases and knowing that you're sick, so we can keep you quarantined, keep you isolated, and prevent this exponential growth that we're experiencing.
Dr. Bache, thank you for everything that you are doing, and we'll keep the community apprised, as we have been, on the increasing numbers, on what we're doing to care for all patients. Thank you.
Thank you, Heidi.